تاسو نوم دی؟
ها.
This is a case of sinusitis, acute sinusitis with orbital cellulitis. It's a complication of sinusitis. You see that eyelids are swollen and the orbit is involved. The disease has extended to the orbit. But the patient is not fit for general anesthesia. We have put him on conservative treatment. He has improved for the last 2 days. Before it was too much swelling, there was too much swelling in the eye, but it is reduced. But we want to reduce the burden, the load of the infection. We have to drain this, to wash the sinus. Before you saw this palate, we have cleaned the palate. There were multiple holes in the palate with pus coming out through these holes. Gag reflexum داسې مې کې په پیک لکه څنګه جی کې چیک دي دلته ګوره دا یو هول دی که نه چې دی کې پس راوته ټیک شو دغه هول پورې به زه دا ایکسپوز کوم ولې چې دا ټول نیکروز ټیشو دی دا لږ سټپ بیکاره دی دا ټیشو ته مونږ را بیلو که نه بایپسي به یې مه کوو د وینې زه ترې نه بغیر انستیزیا دا ټیشو راکړم او دې څه نه وایي که نه یا بله غونته نور هم اوچت کړو دا ځای نه دا تر دې هوله پورې دا د ټول لرې کول غواړي دې کې پس دی دا او د دې پس د وجې نه دته ډېر تکلیف هم دی که نه لږ سکشن پکې دی دا وایټ پس و دلته هول دلته دی یار د هول از هیر become sinus communicates or enteral fistula because of this infection. Now, this will help for the drainage of the sinus infection. We have to widen this. I should remove these tissues all around so that we can expose. Later on, we will repair the palate with this if the patient is relieved from the disease. You see this dirty pus, this is in the sinus. We have to open this and the local. Palatal tissue are necrosed and painless. Now the bone is exposed. When we gave cut here, there was frank pus coming from this area. We removed this soft tissue area from the hard palate, but the hard palate is perforated somewhere, but can't be seen now clearly. And it's completely painless. So we are removing almost maybe here, this area may be a small hole in the hard palate, but all around is intact. But the tissue is numb, completely numb. We cleaned the palate from the pus as well as the multiple foramina which were present in the palate. Now we are going to do a sinus puncture like antral washout. We do for antral washout. This inferior meatus, the end, posterior end. Now we come a little back and go laterally toward the tragus, and this is the medial wall of the antrum. We entered like we do enter the. Now I am in the maxillary sinus without anesthesia, and this is the pus coming from the maxillary sinus. You see in this suction pipe, the pus has been sucked out from the maxillary sinus. From below, the palate is clean. Now the medial wall is punctured in the inferior meatus like we do for tooth puncture or antral washout. Now I will try to wash the sinus. Lagaga trocar and cannula wala the antral washout wala. The wash ku karan dina the load kam shi maxillary sinus bada dakara kana. The suction saram dear raw wata. Plus that the medial wall, right side of the nose is completely numb without anesthesia. Pain or connectivity. We can do much here now. under local anesthesia. I have widened this accessory foramen because its own natural foramen is in the middle meatus. We have made another accessory in the inferior meatus. So this will ventilate properly. The load is sucked out. The first. Now I will give a wash, but it will be difficult. I will do it under controlled suction. Okay, when he brings, this is the suction. It is numb. It's anesthetized. This is a trocar, a needle, and this is cannula we use for antral washout. You see the tip of that trocar is coming out of this cannula. We have to hide this tip in the cannula like this, pull it up to here so that it may not cause much injury to the nose. We have passed this in the inferior meatus. These are the steps of antral washout or proof puncture. When I reach to the posterior end of the inferior meatus, then it is abutted here. I will come a little anteriorly and then turn laterally and push this trocar so that its sharp tip comes out of the cannula, and I will enter the maxillary sinus towards the tragus. It's now in the sinus. We have to wash this. This is in the sinus, you see. We have to wash this. But before that we have to do suction at the same time. The suction of Tony Sabadaban. Kenastation. Hazabada Pamlas Tala da Winza Makana, Neta Badi Buzi, Lucky Usata Zebia Patagaro machine of Basam. Yara that's seven for the anyhow, try to come. The Kulaki Basata, 0 Basam. Kulaki Robas, Kulakuloka, 0 Basara. Yao Jebeta Robas apart. I was a proposal Robas. Kulakuleta Razifleta Robas. Jebesanta Shundu Tarola. Kulakera Wundeka. That's a Bilateral. But you usually be using them, huh? That was a fashion. Cardosho, inshallah, Allah, but it's sticky. How? It's a dark cardosho, can I? Bumra cardosho, and then. Oh. Terawa Maroba, Sabahai. That's a robot. Or is a fool about the Rakari. Never spoil about the Rakari and told it out. I think she was not more she did. I think the Zidia can escalate fee. But local by the Dum Rakari, they have. So that they go medial wall that they pollution. Issue. And natural osteum could be a bundle, but Dama or the Raka. Go to the Polo. That's what. Calcadosho. Palate is a fashion. No, that was fairly with us in the flow and Louis. I hope to be never. That's a whole Dana Canada. But inshallah, Sabah will be able to go to Boloras. That's a code, the Aflaka or the Lego Barawa, a pellet will Louis and other sections. Do they by the wall? Hologa Kuloka half Taluga Levinzama. Fresh Panake, but some Dagas Flaki Jamaka, Biaba Bahara Ulifa. Tirawama, Kulafa Kuloka, Jasuna Kulayuri. But the mother of our Pasra, the Jebesarata, the Bankan was landed Benedica. Come at the Dara de Talin Safashu. Come at the Dala Biawa from your minute. The hair dress in Safo, but who beyond the Jabana, the Alk Banka. Kulakuloka, Alk Sarata Jabab, Utanga Wachibanshi. Kulakuloka. This procedure is difficult under local anesthesia or without anesthesia, but luckily this patient is cooperating well, so it will help this patient. We have to clean this mouth. Jabaroba is a safar to far. آفرین تا خو خوراک هم نه دی کړی که نه وګوره غاښونه دې نه دي صفا کړي جبر وباسه مکمل آفرین چې دا صفا داسې که لږه اوس بل طرف ته یوسه بل طرف دې خوا داسې شابه ورګه لږې اوبه مرای کړي نښتې چې دا راوباسم ګوره محنت چې کوې که نه نو هر څه دا ګوره تا ته یو ورکوټ سټپ دی که نه دس ول هیلپ یو ان فیوچر یو پرفوریشن دا دی بل هم دی یار دی پیلټ کې دا وګوره خوله لږه کوله که انده د پیلټ ټول سورې سورې دی ګوره another hole right? He has some problem in the palate and that has extended to the sinus ځکه دومره perforated palate ما چېرته نه دی لیدلی چې دومره هر ځای کې هولز دي پکې پس پکې را روان دی this should be also opened دا مې open کړه چې پس ته لاره کولو شي که نه نو هغه بیا وځي چې دا به لږ نور هم کولو دا ځای لږ کولو وکړه دا ځای هم درد نه کوي که نه ګوره دا نشه مونږ نه ده ورکړې خو دا پین خپل نه دی وینې دا صرف کولاومه لږه کټ کوم یې نه که نه فیوچر کې چې دا بیا هیل شي ولې چې بیا د پیلټ پرفوریټې دي که نه نو دله دې لیفټ سایډ ته هم انټرل واش آوټ کومه دا بله ساینس هم ډکه ده دا هم ورله کولاوه دا ته ښکاري دا هول هول چې ما جوړ کړو پیلټ دته اړو پین کېږي نه دا بالکل نیکروز ټیشو دی behind this tissue dirty looking material پکې stuff پکې پروت دی I have to suck it out and then wash it out but I would like also to give puncture in the medial wall of the left side too so that it's properly ventilated and drained ګوره دې پوزه کې ما پیک نه دی اخر no anesthesia given but the patient is not feeling anything it's numb completely numb now I am in the inferior meatus up to the posterior part coming a little anteriorly then looking at the tragus of the ipsilateral side I am pushing this like this you see I punctured the medial wall he felt a little pain here this means the medial wall is intact it's not affected too much you see this pus is coming in this tube from the maxillary sinus so the disease is not only in this right side but in the left maxillary sinus also so I have made an opening an additional opening in the inferior meatus the natural is in the medial meatus but that was blocked now we have two windows in the maxillary sinus this will cause a cross ventilation of the sinus and will dry it up so both sides maxillary sinuses are now properly ventilated okay thank you emergency and the disease he had a swollen eye right eye with palatal swelling and right cheek swelling after 2 days treatment conservative treatment he improved but we wanted to explore his sinuses but he has also hepatitis C positive and otherwise also not fit for general anesthesia so we have performed this procedure under local anesthesia we open the palate here only the soft tissues are necrosed and the hard palate is intact but maybe there is small hole in the floor of the maxillary sinus because the pus came out from there also the right side there is a hole and dirty material we cleaned from that we did both sides until washout and now inshallah he will improve